Hi, I'm Dr. Randy Doom, and today we're going to talk about back pain. Everybody's had it. It's a common thing. And what people don't realize is where the location of the pain is dictates a lot of the treatment protocol. And what I mean by that is this. Low back pain, even if you we're told you have a bulging disc or not, is almost never where the problem is at. The problem is 90% of the time revolves around the head of your femur, where the ligaments attach to your low back. And due to sports activity or your feet being pronated or supinated, for whatever reason, these femoral heads become rotated, and if they're not replaced and the ligaments are not put back in the proper relationship, then you're going to continue to have that back pain. Now, spinal manipulation, acupuncture for low back pain is not going to correct this because the problem is below the back, in the hips, knees, or in a pronated or supinated foot. If those three areas are not addressed, you're going to continue to have low back pain, of a biomechanical nature. Now, you can have low back pain from pheochromocytoma, which is an adrenal-secreting tumor. You can have, a number of pathologies associated with low back pain. But from a biomechanical standpoint, 90% of low back pain is going to involve these three areas below that, even if you're told that you have a bulging disc. Because generally speaking, that bulging disc is not going to be more than 3 millimeters, and that's not going to be significant enough to create the type of problem that you have. Now, if that same disc is 5 or 6 millimeters, then that's a different story because you're going to have different symptomology and that's going to have to be addressed. But 90% of the people don't have that unless they've been in an accident. So remember, if you have chronic low back pain, or if you golf or play baseball and it bothers you, 90% of those type of problems are below the spine, involving the hips, knees, or feet. Now, if you have a problem in your neck, generally that problem is going to involve your scapula, because your scapula has a muscle that's attached right to your neck. So if you adjust your scapulothoracic articulation or your shoulder blades, that will realign the muscle that goes right into your neck. And if you have headaches or other associated problems, that's going to get rid of these without an invasive torquing motion or neck adjustment, as the so-called neck adjustment, because those may or may not do anything, but a number of those done in sequential order will cause more problems than they actually help. So look at these areas and think about them as a mode of getting rid of chronic back pain. Or call me, Dr. Doom, the skeletal engineer, and I'll fix you. Call me at 843-602-0002 if you got questions, because I'll make you look, feel, and act years younger.